Good afternoon, everyone. So I'm going to share on the development and application of the markerless motion capture technology, and I will particularly share on the rehabilitation aspect of it. So to give you a brief idea of what is motion capture, this is a technology that tracks the human movement and transfers the data into digital data for further comparison of the human joints position and the human movement kinematics. It has been commonly used in movie shootings, such as the Marvel series, and recent study has found that it has some purpose and it is effective in doing the medical research and rehabilitation as well. For some of its application in the rehabilitation, scientists suggest that it can be used to capture the human movement of the patients to provide them some feedback of their exercise of training. And some also suggest that it can act as an assessment for them to evaluate their movement and know what their physical deficit is and also how severe their physical deficit is when compared with the other kind of patients. But before applying the motion capture technology in the patient, we have to know which type of system to use. For example, traditionally, we use the optical system in which we attach the refractive marker or sensors on the body surface of the patients. This method is an accurate method, but for such methods, it requires the attachment of marker, which will constrain the patient's movement, and also it might cause the discomfortable feeling of the patient. So with the advance of the technology, we developed the markerless motion capture system. This is an AI technology that tracks the human movement without the needs of any sensors or markers, meaning that the patients can just perform the exercise in their natural environment, such as in the hospital or at home. And then the camera will track their movement and pass to the AI and pass to the computer visions to analyze and evaluate their movement. Some brief introduction of how the markerless motion capture technology works. For example, we first do the post-estimation processing. This is by estimating the image of the relevant subject. For human movement tracking, it estimates the pose of the human and the body of the human. And then by the 3D or 2D pose estimation algorithm, we can know precisely where the joint is and each joint's position of the participant. This is some of our current research on the use of markerless motion capture technology. Oh, sorry. So this is a video. One of our projects doing the walking gait analysis for the stroke population. For this project, we used the system by NTU from Singapore, in which we use 8 RGB camera. That's the common CCTV camera for capturing the movement of the patients with a stroke. And you can find in this video that the patients walk just as usual using his stick. And we can use the camera to capture the movement and then analyze the walking gait. From this photo here, you can find a comparison of the knee flexion range of this patient, the right side and the left side, and you may see the significant deficits of one side, which is the hemiplegic side of the patients. Together with the walking data calculated by the system, we can do an accurate and precise analysis of the walking analysis of these patients. And as we know that such a system is very accurate in tracking of the small joints, such as the finger joints and the hand joints. So we have another project, which is doing the validity and reliability of the finger angle tracking of the subject in the healthy adult. So hopefully, if we prove that such a system can provide accurate data for tracking of the finger and wrist movement, this markerless motion capture technology system can act as an alternative screening tool besides the current use of goniometer and eyeball assessment in the clinical assessment. But the system that I have just mentioned has a drawback. that it still needs XRGB camera, and it has a special requirement on the space. So we developed our own system, which is a markerless motion capture system in the iPad Pro with a LiDAR scanner. By this system, we don't need any further hardware device or camera. We just need the iPad Pro or your own iPhone Pro with a LiDAR scanner, which is a sensing of the distance, such as the depth, so that we can calculate precisely the joint position in the X, Y, and Z position to better determine the human position. Our system is developed using the AR kit and reality kits of the Apple library, so you can easily download it from the Apple App Store. We try our capturing of the stroke participants here showing in the video, and we find that it can successfully analyze and capture the movement of the large joints, such as the hip joint, knee joint, shoulder, and elbow joint. And this system has undergone a validity and reliability test under one of our research. The ICC value shows that the ICC is higher than 0.89, which shows that it has a very good to excellent retest reliability, suggesting a potential for it to capture the movement of the patients for further analysis throughout their rehabilitation process. So we have conducted another research. We set several sets of movement, several sets of tasks for the patients to perform, such as the upper limb task and the lower limb task. And we check whether the motion capture system can determine the left and right difference in performing those tasks in the stroke populations. And we also applied a machine learning model to see whether the machine learning model can successfully classify the functional level of performance in the stroke survivor just by doing a few sets of action rather than the standardized assessment. Our result is promising, showing that our system can successfully distinguish the hemiplegic and the non-hemiplegic size difference during the movement from the stroke participants. And the machine learning model can also analyze their level of severity and the motor functional level in the stroke survivors. So it suggests to us that our system can be further generalized to other populations or to do other clinical assessment, which provides a precise and objective data for further clinical assessment and analysis in the clinical setting. For example, it can be due to capture some bilateral tasks or some coordination tasks to analyze the whole body movement of the patients, and also to analyze the bilateral difference between the left and the right sides of the patients. Compared to the traditional eyeball assessment, it can provide more details and more information telling you how the patients recover and how she is doing during the exercise at home. Talking about the home rehabilitation, we have designed an app version for this markerless motion capture technology. This is the app that we have designed. The patient can use this app at home and select the favorite exercise by following the video of how to do the exercise. And then we capture the performance of the patients for the bilateral side, meaning both hand or both neck. Then we have the data analysis for the patients. This allows the patients to capture her or his own data at home in the home environment so that the patients do not have to go to the clinic or the hospital frequently for the pre and post assessment. She can do a capturing of herself at home to record her rehabilitation training performance just at home. And then the data can be sent back to the therapist to a further evaluation on whether the therapist have to upgrade or downgrade the home program. So if you come across any idea of using this markerless motion capture technology in the future, welcome to share it with us. We are looking forward to working with you together in the future. Thank you.